an act of bravery, right? To ask for help, you have to be brave, because you don't know what's on the other side of that cliff, right? It's sometimes it feels like you're diving off a cliff, and you don't know if there's going to be a trampoline down there or if it's rocks. But things will never change until you reach out and try.
Well, welcome to Some Stutter Law, a podcast by the NLSA Collaborative. Some Stutter Law is Newfoundland Labrador's first podcast about living with language disorders. We speak directly to people living with speech and language disorders and others such as speech-language pathologists, researchers, educators, and family members. We use inclusive language and themes to help rebuild confidence and hope by dismantling myths, stigma, stereotypes, and barriers. My name is Greg O'Grady, and I'm a person who stutters and co-host of Some Stutter Law, Newfoundland Labrador's first podcast about communication disorders, along with my co-host.
And I'm Katelyn Mayo. I'm a speech-language pathology student, and I'm Greg's co-host on this podcast.
Some Stutter Law mission is dismantling and rebuilding stuttering. Let's start listening. Some Stutter Law mandate is, in the spirit of Newfoundland Labrador humor, robust, frank, interactive discussions, Some Stutter Law podcast aims to rebuild confidence and hope for today's and tomorrow's persons who live with speech, language, and communication barriers by dismantling stuttering myths, stigma, stereotypes, and barriers.
The objectives of Some Stutter Law podcast are raising awareness, education, understanding, and acceptance of stuttering and communication disorders within our province by providing support, information, research, and resources about stuttering, raising awareness that communication disorders are a quality of life issue. Throughout life, stuttering and other communication impairments can impact a person's life emotionally, educationally, physically, socially, and vocationally. Some Stutter Law podcast is a safe space where guests can be themselves without fear of being judged.
Today, Some Stutter Law welcomes guest Dr. Rachel Goldenberg. Dr. Goldenberg is a leading authority in singing and lung disease. Dr. Goldenberg's doctoral dissertation focused on the use of singing lessons as an adjunctive airway clearance technique for cystic fibrosis, and her article, Singing for Respiratory Health. A literature review was published in 2018 in the peer-reviewed Journal of Voice. She has presented her dissertation research and continuing research in the use of singing for respiratory ailments across the United States, Canada, and Europe. Recently, she has focused her work on helping people with lung disease to better coordinate their breath and the voice through individual lessons and the Breathe, Sing, Move program created at Breathe Well Physio in Calgary. The Breathe, Speak, Pace voice skills program for people experiencing long COVID was launched in March of 2021. Dr. Goldberg has been in demand as a guest lecturer in breathing physiology at universities and programs across North America. As an active and trained singing voice specialist, she frequently assists injured singers, actors, and other voice users referred to her from medical professionals and the voice community. Dr. Goldenberg received her doctorate of musical arts in vocal Pedagogy from Shenandoah University, where she was the recipient of the Dean's Graduate Scholar Award for Exceptional Aptitude for Research and Scholarship. She also holds undergraduate and graduate degrees in voice performance and pedagogy. I apologize for that, Rachel.
Pedagogy.
Pedagogy, which is a mouthful for a person who stutters. From Westminster Choir College in Princeton, New Jersey. She previously taught voice, speech, and pedagogy. And
Pedagogy. There isn't a person in the world who doesn't have trouble with that word.
okay, that's nice to hear. I'm glad to hear that. At Ambrose University and maintain a private voice studio in her native Calgary. She continues to consult on vocal health and lead, breathe, sing, move, and breathe, speak, pace at Breathe Well Physio while pursuing her Master's of Clinical Service Sciences degree in Speech Language Pathology at Westminster University. So welcome, Rachel, to some sort of law.
Well, thank you.
Rachel, could you share with with our listeners how you became involved in doing this wonderful work? Because I'm very impressed with with the quality of work you are doing.
Well, thank you. That's very nice to hear. So pedagogy is the art of teaching. It's a funny word. Like I said, there isn't a person in the world who doesn't stumble over it at some point, because it's not common in the lexicon unless you're in education. So pedagogy in voice is the art of teaching that is informed by science. So how do you take evidence-based practice and put it into something that is translatable to music, and where you can transfer information from the pedagogue to the student. So my degrees are in vocal pedagogy, so teaching voice. And when I was at university at Shenandoah University, doing my doctorate, which was focusing largely on vocal health components. So the idea is that if you're going to be a high-level voice teacher, you need to have skills to be able to deal with someone who has had a vocal injury, whether it's phonotraumatic or of a neurogenic origin, or what do you do when you get that singer who has a structural difficulty or something like that. And so I was lucky enough to spend time in voice clinics, observing all over the US. And around this time, I was introduced to a woman with cystic fibrosis who sings. And her doctors were theorizing that her singing was keeping her healthy, it was helping her lungs stay within actually quite good limits. And I thought that was really neat, and I wanted to know why. And I started reading about cystic fibrosis and airway clearance. And what I found was that a lot of the physiology of airway clearance, so in cystic fibrosis, we're talking about excessive mucus building up within the airway. And that mucus can become infected, and so it has to be cleared, right? So these patients use airway clearance techniques to move that mucus out. When I looked at that physiology, I realized that a lot of the same language was what I was reading in my vocal pedagogy textbooks. So the physiology of airway clearance was matching a lot of the physiology of singing. And that is because when you apply, this might get a little bit too technical, maybe it's more information than you wanted, but when you apply pressure oscillations to mucus or secretions in the respiratory tract, that makes it more easily cleared. It makes it less viscous. And when you combine that with high velocity airflow, which we do in singing, that essentially shoves it out of the airway and makes it more clearable. So you might notice for yourself, when you start speaking or singing, you might have to clear your throat a little bit more. That's partly because you're moving stuff within the airway. And I thought, how can we take that information and apply it in a sort of stealthful way, a hidden way, a fun way of getting this out, rather than just sitting there and doing the therapy, how could we apply that to singing and make singing a useful tool or an adjunctive airway clearance technique? And when I got to Calgary after finishing my doctorate, I joined with a physiotherapist who specializes in breathing and breathing pattern disorders. And we came up with a program that was essentially a continuation of pulmonary rehab. So pulmonary rehab is what patients with lung disease go to become educated about their disease, to learn exercises to facilitate airway clearance and better breathing. And these programs typically last for 8 weeks. It really depends on where you are. And then what we were hoping to offer was a continuation of that. Once you've completed pulmonary rehab, here's a way for us to keep the momentum going. And here are some exercises, here are some strength-based things, here are some breathing techniques, and finally we'll sing. The other thing that has always interested me is when breathing isn't going well, how does that affect the voice? Because the voice is the product of many physiological processes coming together. And so for lung disease, do people have difficulties voicing and communicating as a result of that? And so my job as a voice teacher in that setting has been to work on not just the breathing, but also the vocal techniques so that it's not an impediment to communication, if that makes sense. So in a nutshell, that's why I'm here. And I'm now doing my master's with Katelyn so that I can work in a more clinical way with this patient population.
So you just mentioned it briefly, but did you want to share a little bit more about why you chose to pursue your master's and kind of what that will look like once you have your master's and all of your many other degrees?
Yeah, the overly educated. The obvious, there's a lot of trajectories for somebody within speech pathology, which actually makes it really appealing. Because you can work, in a school, you can work in a hospital, you can work in a private clinic. There's a lot of different ways. And when people talk to me about, what I might want to do, they sort of assume that I'm very interested, or I'm exclusively interested in working with injured voice and working exclusively in professional voice and all of that. And that is true. I am very interested in that. And that's, a skill set that I have. But there's a lot of other things that are actually very interesting to me. And one of the reasons why I'm here is because not only is it voice that affects respiratory patients, but the people that I was seeing one-on-one were having difficulties with things that I couldn't address, like swallowing. For example, a lot of respiratory patients were having difficulty with swallowing, and I couldn't help them with that. I've had over the years people with fluency issues that I didn't necessarily have the clinical skills to help manage, but I had, some of the practical tools. So, we're taking our fluency class right now, and almost every day we have a new lecture, and I go, oh yeah, okay, I get it. I see, right, okay, this is how I would take what I already know and how I would apply it in this manner. So that's really fun for me, and to have the clinical designation at the end of this is actually going to be very useful because, I'll be able to help many, many more people than just, people who could come to me for a singing lesson.
So you mentioned how, gosh, my brain, when we're in lecture, what you hear and you're like, oh, this is what I already know and how it applies here. But I know the other day you mentioned we did training on some different fluency shaping techniques, and you said that you used those with some people you were working with for voice and respiratory disorders and things. And so did you want to talk a little bit how kind of it works on the flip side?
Yeah. And, just today we were having some speakers talk to us about their lived experiences with dysfluency. And one of our speakers actually said that one of the most helpful things for her was breath technique. And I go, of course. You know, as a trained voice teacher, I'm constantly observing how people are producing their sound, right? I'm very curious about that. How do you make the sounds that you're making? Of course, I remind people I'm also listening to what you're saying, but you know, I'm very curious about that. And breath flow is the foundation of all sounds, right? It's not going to, having good breathing is not going to solve all of your problems, right? If we were all great breathers, then shouldn't we all be great singers? It's not true. So breath itself is a foundation. It's not the whole house, right? And when I teach, that's one of the first things that I address. Then we go into other things, other aspects of sound production. So when I'm working with people with long COVID, for example, who are coming to me for just some general speech retraining, some speech skills, that's what we do in Breathe, Speak, Pace. We'll work on the breath, but then those very slow sounds are very helpful in facilitating that forward airflow, the chance to pause and take a breath and learn that you are still intelligible even if you're not speaking at a mile a minute, right? That if we slow down, we actually communicate very well because people are able to listen to us. So there's a lot of aspects, I'm sort of talking in circles there, but there are a lot of aspects of that technical training that applies not just in fluency, but in the way we present fluent speech. Does that make sense?
Rachel, listening to your work, it really sort of, dovetails with speech, speech language treatment for people who stutter, because as a person who stutters, as we all know, one of our main issues is that people who stutter do not breathe right appropriately, because we don't take full breaths. We breathe from the chest and not from the diaphragm. And I think so one of the challenges that many people have is that when learning how to take the appropriate full breath. And when I was taking therapy, we used we actually focus on two main targets. Well, several targets, but as you mentioned, one of the first targets that were learned in my program was that the stretch syllable, and that's when you sort of the duration of each syllable and each sound within the syllable is exaggerated well beyond its limits. And so when I'm saying my name is Greg or Grady, it's very difficult to stutter. And then so as we move forward, we sort of start with a 2-second stretch, and then the 1 second stretch, and to a half a second to a slow normal. And then part of this is the working within the breathing. But I find this is myself personally, is that when we're trying to get a message out, concentrating on these targets and then trying to control the anxiety, because people start to go through a lot of anxiety. Anxiety is associated with stuttering. Would you be able to elaborate on what you do with your clientele with anxiety? Because I'm sure that anxiety affects their own breathing as well. Can you elaborate?
sorry, I want to interject for 1 second because we have a fluency final exam on Friday. And I am wondering, Rachel, if you can guess which program Greg participated in by the targets he described.
Oh gosh, you're putting me on the spot.
Studying. I know the answer.
So back to the anxiety question. How many people feel, probably of your listeners, if I asked you to get up and sing a karaoke song right now, who wouldn't be feeling anxious about that, right? It's a different kind of anxiety, but it's performance anxiety, essentially, right? This built up pressure of, oh my gosh, the sky is going to fall if I fail. And one of the things that we learn in singing is that, first of all, the sky doesn't fall. And we desensitize our students to that fear, sometimes by throwing them into the water and hoping that they can swim when we put them up on, in the festival stage or in a performance, in a recital. And sometimes it goes horribly wrong. It's gone horribly wrong for me. And yet we're still here, right? So a lot of that fear we learn is in our head. In fact, one of the speakers, two of the speakers today brought up that when we are afraid of stuttering, that we're afraid of the reactions that are going to come back at us. But a lot of that is not real. Sometimes it's real. Sometimes you meet mean people, right? But for the most part, people are very understanding and very forgiving. And so learning to shift the mindset that way is part of what I do as a singing teacher and part of what I know happens in fluency therapy, right? So we're shifting that mindset. It comes down to a lot of tools, that positive self-talk, the belief that, the understanding that, what would be the worst outcome, right? What's the worst thing that would happen? And then there are also the technical tools available to us, right? So that's where an integrated approach to fluency therapy is actually really helpful, because not only is it about your mindset and your positive mindset, right? It's also, okay, when I need it, are these tools available for me to speak in the way that I want to speak in a particular moment, but it's within my control rather than the stuttering controlling me, right? So when I apply that to singing, for example, we teach very good breath technique. Although, is breathing good or bad? I don't know. A stable breath, a reliable breath technique, right? Where we have that cognitive input where we can say, okay, I need to breathe in such a way to know that I'm going to be able to make it through this phrase. I need to open my mouth in a certain way. I need to shape my vowel a certain way. All of those things we practice. And this is a concept called motor learning. We lay down a skill, a motor plan, and it becomes automatic over time. We practice and practice and practice so that we don't have to think about it so much. And so that's where we have another parallel, is that we're practicing those targets. We're practicing that breath, that slower speech, so that it's available to us when we want to choose to use it. So all of that goes hand in hand, right?
You're right, Rachel, because it is definitely a mindset. It really is a perspective, one's perspective. And there's sometimes I feel that people who stutter are our own worst enemies, because we're so conditioned and put so much pressure on ourselves to be fluent, because we need to be accepted. We need to feel equal. So I feel that we base a lot of the negative reactions in our past is still there, and just to work through all these negative all these negative reactions experiences we have in life. And but you're right, it's almost like, you know. Oh, also I meant to say the program I've taken, as Katelyn knows, is the Fluency Plus program through the Speech and Stuttering
I had
Institute.
a feeling.
The Fluency Plus program, and you know, so really, Rachel, I'm so thankful to the SSI, Speech and Stuttering Institute in Toronto, because I used to have a severe stuttering. I had a lot of you know, secondary characteristics, and so this program really helped me manage my my stuttering. And I mean, like everything else, much like your clientele as well, depending on how we're feeling, we're also stuttering is very fluid. We have our good days, we have our bad days, and we have our excellent speaking days, you know. But the most important thing, as you said, is it's practice. You've got to continue to practice. Really pay attention to your mindset, because you have to be careful because when we're, well, whatever we're thinking, we're listening to ourselves as well. And but you're right. I think we actually put too much pressure on how we perceive what the listener is saying, and I think we tend to succumb to our emotions. And I think this is where we need to control or harness our emotions, you know, and practice honor techniques, therapy, whatever, you know. And really, when all is said and done, I mean, this is a quality of life issue. And your work, Rachel, is such a comparison with Dr. Stuttering. It really is, it dovetails a great deal in terms of the breathing.
Yeah, I can see a situation in my future where I have a singing class and an integrated singing class, speech class for people who stutter. There is literature to support that singing is actually, well, a lot of people don't experience disfluencies when they're singing, and there's some literature to support that, in that there might be a difference in the change in the auditory processing. We listen to ourselves in a different way. We have that auditory feedback loop during singing, where we're constantly adjusting the pitch and the volume. We're listening in a different way, and so people who are in choral situations also choral reading tend to not have experience the same disfluencies. So there's something about the way that we learn to listen to ourselves that I wonder whether or not that could carry over in a way that could be helpful. And if there's a way to turn singing into something that could be transferred into speech for somebody who stutters. I don't know, because I haven't had that much experience with it, but my gut instinct is that there is a way, and it's not going to be that difficult to figure out what that way would be. And I think you probably would have listeners who have said, oh yeah, my singing helps. You know? But singing lessons alone, I don't think are the answer. I think there has to be some way to make it transfer to speech and regular life. So there has to be some bridge there.
Yeah, I was going to mention if you had seen any of the literature on, the integration of singing and for people who stutter, because I've looked through it quite a bit. I've got a friend who's doing music therapy, and I myself grew up as a singer, so I also kind of was interested and had this feeling, and have thought about maybe even, as we were talking about the anxiety, since it's shown that people who stutter are fluid when they're singing, if this might be, something could use to combat the anxiety, even if it doesn't help them be fluent in their speech. Is it something that can be a confidence booster? I was just wondering what your thoughts on that.
100%. So in my research, so going back to the lung disease world, every time someone studies singing for respiratory health, they do two types of measures. They do the physiological measures, and then they do a quality of life. We're not so great at making physiological changes. Whenever we teach singing, we actually don't see a lot of change on pulmonary function tests. But where we do see changes across the board is in quality of life enhancement and measures of feeling in control and mastery of the condition. So people feel more confident. In fact, I remember that was like highlighted in capital letters on a feedback form that I received from one of my dissertation participants. I feel more confident. And when you've got somebody who has a chronic condition, that confidence goes so far, right? And so you will always feel better when you sing. Okay, I won't say always, but because there will definitely be times when you don't feel better. There have been many performances where I've gone, I'm never singing again. But the research really supports that people feel better when they sing. There is cultural evidence, cross-culturally, lullabies exist, and every culture has at least some form of octave. So music plays a large part cross-culturally for a reason, and that is that it unites us. Our heart rates sync up when we sing together. It motivates us. It takes away the feeling of work. And so when you put that into the context of delivering a therapy, which can be, if you've done Fluency Plus, you've been sitting there doing drill, right? If you can do those drills in a funner way, I don't know how the PC way to put that. If you can find a way to make it less effortful, I think that's a positive thing. And I hope that, more of that research will come out. And certainly our music therapy colleagues are great at reducing the social emotional side of a plethora of chronic conditions, because we know that music can do that. That is really well established. So, now it's just a matter of putting into this context, which I think totally could happen.
Yeah, it's something I've been thinking about a lot. Greg and I recently interviewed a group of people who run an improv group for people who stutter.
Mm-hmm.
And I thought that was so cool. And I thought, how cool would it be to have a similar program with singing, a choir, or a karaoke night, something like that. I think would be so cool.
Yeah, improv is great for fluency. That spontaneous thought process is, it's hard on the best of days for even pros. Yeah.
I'm smiling and laughing, listening to you, Rachel, about singing, because years ago when I was much younger, like I'm from a musical family. So my brothers had their own bands, and play guitars, drums, and accordion. But I'd love to sing. I've always wanted, way back then, I always wanted to be a singer, but I can't sing. I wouldn't even try to sing here because I sound like anyhow. So it isn't very attractive to listen to me singing. But
Well, listen to yourself now. What kind of self-talk is that?
Negative
In that we are
self-talk.
in a fluency podcast here. What makes you think that you can't sing or that your sound isn't good? Who's telling you that?
It has to be. I have to have the perfect octave. I have the perfect octave. I want to be the front of the singing group, not the back. But anyhow, it's true though. I still enjoy. But you're right. It's all in mindset. So as long as, whether you're singing in your shower or whatever you're doing, but you're right. I like what you're hearing about the fun component of this, especially when you're doing the speech targets, practicing the shaping. And I think you're right. If we can make it more fun, and then because I never really considered incorporating singing into a therapy. So I think you're right. There's a bridge there somehow.
Yeah, it's just a matter of finding it. You know, I also am working currently with a professional singer who has a condition called spasmodic dysphonia. And what I find is that he is able to produce a clear sound when he thinks musically about his speech. So, for example, if I say, I had toast for breakfast, I could say it in a more musical way. I had toast for breakfast, which might sound a bit odd for the regular person to be hearing, to be speaking that way. But for a trained singer, this is actually how we talk very often. It's not odd. So to take that and shape it then, you know, as a way to do fluency shaping, you know, that's beyond just the drill targets. I think there is something to be said for that, right? To be changing that concept of what you're supposed to sound like. And this is something that comes up in voice a lot, is that we have this auditory image, like sort of like when you get a haircut and you like a drastic haircut and you look at yourself in the mirror and you realize you're the same person, but you look different, right? Sometimes when we do voice work, we're getting somebody to get a drastic haircut, right? We're changing something that's not fundamental about them, but obvious, right? And that's hard. That's hard to do, and you have to do a lot of desensitizing around that. But these are all tools that we can use in order to overcome the obstacles that are in our path, right? We have to think about changing the way that you sound. That's part of who you are. So a lot of that work, I think, also happens in fluency too, because you're having to think about the way that you're producing your sounds.
We also use use another target within the Fluency Plus program, and it's similar to what you just said, is in terms of the enunciation. It's the full articulatory movement, and it's similar to like a singer is trying to sing like, "What did I have for breakfast?" And this would be opening your mouth and really sort of concentrating on the voicing. It's to decrease physical tensioning in the jaw and neck across, and to feel muscle movements for other target behaviors. So when I'm doing this, it does have a singing component. My name is Greg O'Grady. I'm a
Yeah, and you
person
can
who
put that on
stutters.
pitch.
Yeah.
My name is Greg O'Grady. Right?
Then I'll try privately.
But look, to go back to where we were with the breath, a lot of tension in the articulators is actually compensation for poor breath flow. That when the breath isn't functioning to really as a foundation, another part of the system of the house, of the whole house. So we have the respiratory, we have the articulatory, we have resonance, we have phonatory. One of those systems is going to compensate somehow. And having worked with people who have impaired respiratory systems, one of my first targets as a voice teacher has always been to work on the jaw and the tongue tension, because they tend to compensate. So we do a lot of work stretching the face, stretching the tongue, learning to phonate without using those. And Katelyn, I would remind, just to reminisce a little bit about when we were learning when we were doing our training, when the cue was release your jaw, nobody breathed. Everybody stopped breathing. I don't know if you remember, we had sounds like oven, right? So the jaw is loose, but now the breath isn't moving, right? And people stopped blinking, right? The tension was transferred elsewhere. So as a voice pedagogue, it's all well and good to talk about loosening the jaw, loosening the tongue, but you also have to address other things too. And speech isn't always obvious to people. Speech sounds are not always obvious to people, but if you put that into singing and you say, okay, now put this on a pitch, oven, right? It'll show up, and you then have a chance to change the way that you're producing that sound because you can hear it. There's a little bit more feedback there. So that might be one way that it gets linked.
I kind of want to shift gears just a tiny bit and talk about acceptance and accepting your stutter, because I know when we were discussing in one of our discussion groups, and you kind of made the comparison between the chronic disorders that you work with and stuttering, and kind of how acceptance is central to both of those things. And I was just wondering if you wanted to share a little bit about that, because when you spoke about it before, you said such great things. So
I have to remember what I said. You know, I've had to do a lot of reflective practice in terms of my teaching over the last year, and that's because we started working with people experiencing long COVID. And this is new. This is new path. Nobody has experience with it. One of the reasons that I started working with long COVID patients was twofold. One, that I was in a physiotherapy practice that was getting inundated with people looking for help with long COVID. And the other one was that there was quite a bit of news about the English National Opera starting a program for singing to help people with long COVID. And I wanted to make sure that things were working well in those terms. And I was, very, very curious about this. So we started our own group in March of 2021. Gosh, it feels like a lifetime ago, but that was within this last year. So we started our group, and things didn't go well in the beginning. Long COVID is a completely different thing than I've ever experienced before in 10 years of working with people with impaired respiratory systems. It's completely different in that anytime you exercise someone, not anytime, but certainly the people that we were working with, there is a risk that you cause an energy crash, essentially. And this is very glossing over what could happen. But what I learned was that singing was too physical. It was too physically involved for a lot of our participants. And I had to learn to make everything much more simplified. I had to adjust the way that I was delivering the information to make it very easy. And what I thought was easy was still too hard. And I had to be very, very careful. And one of the things that came up for me as I was reflecting on how to deliver speech skills to people who were having difficulty concentrating, who were having difficulty managing their energy, and who were having difficulty not being angry, I had to realize that as opposed to the people with asthma or COPD that I was used to working with, COVID happened very quickly. And, we were sold that COVID was a 2-week thing. And, unless you're hospitalized, you're going to get over it. You're going to get better. The end. You might get really sick in the meantime, but we weren't sold this year-long lack of energy. And a lot of the people that I'm working with actually can't return to work as a result. So there's a lot of anger there because this happened really suddenly, as opposed to the other diseases that come on gradually and we have time to sort of reconcile with it. And one of the things that I really observed was that the people who accepted that their life has changed, that they don't have as much energy as they used to, that they're going to have to find a different way to deal with it, they were able to not recover, but get on the pathway to recovery, whatever recovery might look like. And we still don't really know. They were able to get on that pathway in a lot easier way than the people who were just holding on to the anger and denial and the blocks that would come up when I would make suggestions about, well, let's try this. Have we considered, whatever, that they weren't ready to receive that information because they were not accepting of where things were. And, that takes time. And that's not getting somebody to accept their condition is not something that I am skilled in doing. That's merely an observation that I made as somebody who was, trying to offer strategies to help. But I think, I'll also remember one of my participants in my dissertation. She was telling me about her mother who received the newborn screen that her child had cystic fibrosis. We screen all newborns for cystic fibrosis, and you find out, probably within the first week of life, whether or not your child has this. And, my thought was that the mother must have felt completely devastated when she found this out. But my participant said to me, no, what she tells me is that she was sad for a day. And then she said, okay, I'm going to read and I'm going to learn and we're going to manage this. This is the lot that I've been given. Okay, let's go. And I find that really inspiring, this particular participant is living a full life, doing all kinds of things. And one thing that I really like to take away is that the disease is only a small part of who you are. You are so much more than your condition. So, are you going to control it, or are you going to let it control you? Right? I think that's really a part of being able to live with a chronic condition. That's the acceptance.
And this is the key for people who stutter. Is this we actually struggle with various levels of acceptance of stuttering. And I think one of the key issues, and this is Greg O'Grady talking here, I think within us, people start. There's anger. There's an anger associated. Why me? Is almost like the victim mindset. But I think and I think people who stutter need to go through and acknowledge there's a grieving process here. There's a part of grieving as well, like Elizabeth Kubler-Ross, the various stages of grieving. And I think that as Katelyn and I have discussed with a number of our guests, is that it's just a journey that you have to acknowledge the emotions, the anger, the shame, and because I think the longer that we hold on to these emotions, we're being blocked. It's blocking us from moving towards acceptance and moving towards a quality of life, living life to its fullest. And I think that has a lot to do with it. And then listening to you, Rachel, working with your clients, I think it is so similar to what people who started going through as well.
I like you do have to grieve. That's really important. You have to find a way to acknowledge that you're grieving and move past it. And if you block that down and stuff it down, and you internalize it, it will come up in other ways that you don't want to necessarily know how they're going to come out, right? So that mental component is so important.
We often use use the analogy, the African proverb analogy. it takes a village to raise a child. It really takes a province and so sort of a team, an interdisciplinary team to work with people who stutter, and I'm sure with your community as clients as well. And so, when do you, as a in your program of Breathe, Speak, Pace, do you recognize when somebody needs further support to go through the emotional component?
Yeah, so I'm very lucky that I am still on that interdisciplinary team, that I'm still working with the physiotherapist who makes the referral into that program. Nobody gets into our program without seeing her first. And so there is that one-on-one component. There's another side of the program that involves a wide variety of disciplines. So we do have pathways for people to get more resources within the community. And I think that's really important, that we acknowledge our limitations as clinicians, where our lane ends and where another one begins, but we have to communicate and we have to be friends with them and be willing to share that responsibility and know that you can't be all things to all people. And I've been very lucky that way. And I think part of that is my training as a musician too. You know, in an opera, you have a director, you have a lighting designer, you have a costumer, you have the orchestra conductor, you have all of these people. I can't imagine not having the people to refer out to. And I think it's crucial. It's crucial.
You know, do you have any advice for those? Well, I'm thinking in terms of people starting out who are isolated. I've been very fortunate, and Katelyn and I've spoken to a lot of our guests who have taken therapy and have tried therapy. But for those people who may be listening that have chosen not to take therapy or not even aware of it, how important it is to really try to reach out to these people to get some support.
Yeah, it's an act of bravery, right? To ask for help, you have to be brave, because you don't know what's on the other side of that cliff, right? It's sometimes it feels like you're diving off a cliff, and you don't know if there's going to be a trampoline down there or if it's rocks. But things will never change until you reach out and try, right? And I think, people are really invested sometimes in their status quo, but when they're ready for that, when that disturbance comes and they go, oh, I just can't anymore, it's okay to ask for help, and it's okay to explore. And I have always found comfort knowing that I was never the first person to try to do something, or, there are other people that are in the same situation, right? So that peer support is really critical. And that's actually something that really comes up a lot in the Breathe, Speak, Pace, and even in the Breathe, Sing, Move. It's having other people who are, trying to sing with an oxygen tank, right, attached to them, or other people who are only able to lie on the couch because that's long COVID. Knowing that you're not alone is huge. So reaching out for peer support and finding the courage within you to ask for the help and make the change. That's to me, that's admirable. That's really admirable. And it is something that we need to congratulate people for, because that's huge. It's huge to ask for help.
And I mean, and to actually take that step forward, as I agree with you, it really is. It shows a lot of courage, but it's a lot of because once you acknowledge, it's a huge commitment and responsibility to follow through, to go down deal with what I call these secret scaries. And I think it's part of the issue as well is fear of change, because many people thinking about people stuttering, our identity is so centered around stuttering. What will happen now if I am able to manage my stuttering? There's definite changes, causes more anxiety. I mean, will that impact my relationships, my career, my partner, my wife, children? So it's a huge plethora of things we have to deal with. But I agree. When all said and done, it's a quality of life issue. It's a choice we have to make. Yeah.
Mm-hmm. Yeah, and it's a choice that I think it's important to communicate. You can make this choice now, or you can make it later, or you can make a little bit of choice now, you can make a little bit of choice later, because you say it's a huge investment. And people really want that quick fix. Let me just take the pill and be done with it. But to do the work, that's hard, right? And there is no quick fix to anything in music. There's no quick fix to fluency either, right? And I mean, there are some things that you can do for immediate relief, but in some cases, but really the long game is what you're playing. And so you're really investing in yourself. And that's tricky. And that's, again, where the counseling component comes in, that shifting your mindset is really, really important. And having the skills as a clinician to facilitate that, I think, can be just as important as being able to teach breath and teaching articulation. That's, I really think that those two are going to go hand in hand. So Katelyn, you're right to be wanting to go and really investigate counseling. I think that's going to be stellar.
Thank you. Yeah, I get so like nerdy when I start talking about this, and we've been talking for so long, so I don't want to take up all kinds of time going on and on about counseling. I did want to ask kind of one thing to kind of tie everything up, kind of a selfish question, but so this episode's probably going to be posted around beginning of January when we're starting a new semester. And I know a lot of our class loves Rachel pep talks, and you just have a lot of experience in academia as a student, as an instructor, as a professor. And I'm just wondering if you wanted to give some words of wisdom for students in a very hard, demanding program, whether that's our class or I know there's other students who listen to this podcast.
Oh gosh, Katelyn, you just warm my heart. Thank you. I'm right there with you. It's hard for me too. And I have a lot of experience in ways to, layer this information, but I've also got 2 kids, and I've still got my teaching going on. Here's the thing. I started off thinking I was going to be a star at the Metropolitan Opera. And very quickly, that didn't happen. I actually failed my second year voice jury. If anybody's listening to this who's a voice major, you know how dire that is. I had to repeat it. And you know what? I framed that letter that said that I had to repeat it because I am still a career musician. And one thing you learn in the arts is that you fail a lot. You fail a lot more than you win. And I don't think I've ever won a competition. I've done well in things, but you chart your own path, and you get what you want out of your program. Your grades, they matter, but they don't really matter. What matters is what you take away and who you are at the end of this. And the other thing is you have so much time to figure out what it is you want and what matters to you. And, I'm young now and I'm nearly 40. You're really young. There's so much time. The difference between this year and 5 years from now is,
I'm starting to feel very old now, ladies,
I I said I'm young. I'm young. So, you've got time to explore, and so don't put so much pressure on yourself now. It's not worth it. There's lots of life left to figure out.
See, Greg, Rachel's like our class mom.
When I taught, my first job out of my master's was in classroom teaching. And I taught at an all-girls school K through 12 in Richmond, Virginia. And I think we figured out that the first graders I taught when I was 23 are the same age as you. So it's like I've gone full circle.
Rachel, for some reason or another, I had a vision. Once I read your bio, I had envisioned you being much older. For some reason, because there's a lot of wealth of experience here, a lot of so I applaud you with all your work. And as I mentioned before, we learned so much. Katelyn and I learned so much about stuttering, but the various techniques. You see, for a person who stutters, now we're talking about read, speak, and pace. And we infuse the group improv, and there's so many venues that if the traditional speech therapy doesn't work for you, you can try other areas or just merge it. And so I think the more that we bring on guests like yourself on Some Stutter Law, we're giving people making people aware of other options available, than the traditional therapy. Yeah. But
Yeah,
also,
that was always my hope.
Go ahead.
That was always my hope with Breathe, Sing, Move, that it would be another option, another way to achieve the same end goal. Exercise prescription is huge in respiratory care, and not everybody loves to exercise. So what if we could demonstrate that singing could do the same thing for you? If you don't like to go to the gym, how about joining a choir? Right.
And also, as you mentioned earlier, the possibility of emerging or incorporating aspects into traditional speech therapy, like singing. I think there's a huge. I normally think there's a strong possibility, strong potential here, because I wasn't aware of the breathe, speak, and pace. It's so similar to, what we're doing in speech therapy, that it's there's something to it.
Yes, something to it. Hopefully it evolves into something more. And when I have a clinical degree, I'll be able to explore much more of that more side.
Well, Rachel, thank you very much for your time. I always enjoyed listening to the guests and sort of interviewing the guests. As I was saying that Katelyn, I feel very humble because we're always learning so much as well, So thank you very much, Rachel. Katelyn, anything to say?
Not really, just a very big thank you to Rachel. This is our final exam time, and I know that Rachel is so busy. I don't know how she has time to do everything that she does all the time. It's crazy.
When you're a mom, you just get it done. You realize how much time you actually have in a day.
But yeah, that's what I wanted to say. Thank you so much for chatting with us. I know that our class is going to love listening to this, and I hope lots of other people love listening to it as well.
Well, thank you. That was truly, I'm really honored that you asked me. That's really nice. Thank you.
Thank you, Rachel. Thank you. Thanks a lot, Rachel. It's been fun.
Well, thank you. That was really lovely for me too.
It's a super fun way to spend my day before I go study for hours on end.
Okay.
Hours and hours.
Yeah. The best of luck, ladies, with your exams.
Thank you.
Thank you.
Take care.
Some Stutter La, Newfoundland and Labrador's first podcast about stuttering, has so much to talk about. Let's start listening.
This has been an episode of Some Stutter La, Newfoundland and Labrador's first podcast about stuttering. Some Stutter La is hosted and produced by Greg O'Grady, Katelyn Mayo, Dr. Paul DeDecker, Melanie Crane, Emily Murphy, and Luca Dinu. Some Stutter La is available on Anchor, Spotify, Breaker, Google Podcasts, Pocket Casts, and Radio Public. You can also check out the Some Stutter La channel on YouTube. To ask a question, send us a comment or suggestions, or just to get in touch, find us online at Some Stutter Podcast on Instagram or at Some Stutter La Pod on Facebook. Thanks for listening.